I'm Greg Jarrett, and it is time now for Sunday House Call.
And I'm Marcel Neville. Welcome. Joining us is Dr. David Samadi, Chairman and Professor of Urology at Lenox Hill Hospital and Chief of Robotic Surgery.
Dr. Mark Siegel is with us, Professor of Medicine at NYU's Langone Medical Center, also author of The Inner Pulse, Unlocking the Secret Code of Sickness and Health. Gentlemen, good to see you both.
Good to see you, Doc.
Good to see you.
Okay, well, it is May 1st, and May is American Stroke Awareness Month. It's a condition that impacts some 7 million Americans. It is the third leading cause of death in the U.S. Dr. Siegel, first of all, how do you even know you're having a stroke, and do you always know that you're having one?
You don't always know if you're having one, and 30% of the time we never even know what caused it. But what you need to be on the lookout for is, are you having some facial weakness, number one? Do you have weakness in your arms or legs, one side more than the other, or tingling, loss of sensation? The third thing you look for is speech problems. And are you understanding me? Are you suddenly having trouble understanding me? And then, if all of this is happening, you call 911 because time is brain, and we like to say. Get you to the hospital quickly, and we can reverse the stroke before it's even finalized, and you could end up with no damage whatsoever. That's modern medicine.
How do you reverse it? What do they give you?
They use a clot dissolver. They use something called TPA, which is a clot dissolver. They inject it. It's got its risks of bleeding, but if you're having a stroke, you're going to want that risk taken. And a lot of times we can reverse it.
Dr. Samadi, what are some of the risk factors?
So this is a big message for people. High blood pressure, Greg, is on top of the list. If you're consuming a lot of sodium, processed food, you're at risk of having high blood pressure. That's the main risk. Diabetes, everything we've spoken about in the last 5 years, diabetes, obesity, high cholesterol, because there are two types of stroke. One is embolic, meaning that you form blood clot in the heart. So if you have cardiomyopathy, heart disease, atrial fibrillation, you can form a blood clot and you can shoot it up to the brain and you can have a stroke like that. Or you can form a blood clot right where the vessel is. So diabetes or smoking, especially in pregnant women, they can damage the vessels, you form blood clot, and they stop the blood from going there. What is a stroke? Stroke is the same thing as a heart attack, except it's attack on the brain. If you don't get enough blood to the brain, you're going to have dead cells, and that's what stroke is. So as Mark mentioned, the mnemonic is fast. You basically look at someone to smile. If you are in the street and somebody's having a stroke in front of you, ask them to make sure they smile, facial drooping. Ask them to hold their hands. And if one arm is weak, that's why there is a problem, slurry speech. And again, time loss is brain loss. Call 911.
So, Dr. Siegel, what does it do to your body, short-term and long-term?
Good question.
Well, short-term, we're talking about death of cells here. We're talking about death of brain cells here. And you have 24 hours to reverse that. If it hasn't happened yet, it's called a transient ischemic attack. Once it's 24 hours, we have to look forward and say how we can rehabilitate you, which is what you just said. Interestingly enough, if you have a bleed in your brain, which is one of the things David just talked about, 2/3 of the time it's not a bleed. It's that blood clot or a vessel narrowing off and closing off. We rehabilitate you differently. If it's bleeding in the brain, you do better. But what we've got to do in rehabilitation, and we don't often talk about this here, it's very important. We've got to get physical therapy involved. We got to retrain you to speak properly. We got to strengthen those limbs so that they don't get spastic or paralyzed. There may even be a role for Botox in the situation to loosen up the spasticity.
And you know we love preventative measures if it's possible. What can you do aside from, you already told us about the fatty foods and processed meats and we should stay away from that. Is there something else we can do?
Don't be sedentary.
Absolutely. So that's a good point. Study after study shows adding exercise to your regimen reduces risk of stroke by 30%. Stop smoking reduces by 50%. But, going back to what Mark was saying is that when you catch them early, it's amazing how these patients can recover and even go back to the way they were. Once you let 24 hours pass and the damage is done, that's when you're going to have permanent issues and it's a problem. Now, as a surgeon, the first thing you want to do is to make sure that you stop any kind of pressure buildup in the brain, because anywhere in your body you have room to expand except your skull. Surgery, you open it up, you drain the bleeding.
Pardon me, because I want to help the people. You are the expert in surgery in the operating room, but Dr. Siegel, what if you are there with someone who has a stroke? What should you do? You're not the person, but the person next to you is having a stroke. What should you do?
Well, 911, get them to the hospital right away. You can tell because you look that they're having trouble forming their words, they're having trouble understanding you, they're having trouble moving one side or in the other. You call 911, get them to the hospital. when they get to the
But do
hospital...
you touch them? Do you do anything? What do you do?
Well, you make sure they're not choking. That's
Okay.
what you do. You make sure they're breathing
properly.
properly.
Look at their wallet and see what kind of insurance
You
they
make
have.
sure they're breathing properly. Get them to the hospital. Make sure that the doctors are on them right away. Triage them very quickly. Get their blood pressure under control. Because hypertension is not only a big risk factor for a stroke, it's something that's got to be controlled
Actually,
while you're having one.
The period from the time that they enter in the emergency room to the time that they get treated, that's really the efficiency of the emergency room to show how fast you can get to them. If it's a bleeding, you can always open up and put a clip on the hemorrhage. If it's an embolic one, you can basically either angioplasty or remove the clot.
3 hours, 3 to 4 hour window to get
We're going to have to leave it at that. And family history, by the way, is also a
Very
risk
important.
factor.
Very important.
I know that.